everyone. Thanks for joining us today. We hope you've had a great start to your week and that you are excited to be here with us to learn a little bit more about the Protective Factors Survey. My name is Rebecca Gillum. I'm with the Institute for Educational Research and Public Service at the University of Kansas. We've worked a lot here on the PFS, which you'll be hearing more about throughout the morning. I'm going to introduce you to your primary speaker for today, Mary Morales, who's also with the Institute, and she's going to share a little bit more about what we're going to be doing today.
Thank you, Rebecca. As Rebecca said, I am with the Institute for Educational Research and Public Service. More specifically, I'm the Community-Based Child Abuse Prevention Program Assistant here in Kansas. And today we are going to be talking a little bit about guidelines for administering the PFS and collecting and managing that data. Rebecca's going to give you a little background, and we're also going to talk about tips for reading and interpreting that, and hopefully by the end we'll have a little bit of time for questions. I am going to turn it back over to Rebecca, and she's going to give you some background on the Protective Factors Survey.
Thanks, Mary. As many of you know, the Protective Factors Survey has been designed nationally through partnership with the Friends National Resource Center for Community-Based Child Abuse and Neglect Prevention, or CBCAP for short. The work around the Protective Factors Survey was really initiated because of a shift to focus on protective factors rather than risk factors. There were some individual measures that would measure specific protective factors. So, for example, measures that would measure knowledge of parenting or would measure parental resilience, but there were no surveys or tools that were designed to assess multiple protective factors. Many of you are probably fairly familiar with the work from the Center for the Study of Social Policy around development of our Protective Factors Framework, which is part of the Strengthening Families approach. This tool was designed in alignment with that approach to measure multiple protective factors, and we'll talk a little bit more about that as we go. The Protective Factors Survey underwent rigorous testing nationally. It was originally started by Friends and the University of Texas. The University of Kansas entered into the partnership during the second year and became the lead agency in testing. There were frontline folks as well as agency leaders and state leaders involved through all levels of development of the tool, as well as experts in the field and families. 4 phases of testing happened over 4 years, and it has been validated for use as a measure of child abuse prevention efforts. Many of you are probably already familiar with the Friends National Resource Center. Many of the items that we're going to talk about today are available on their website at friends, Friends, nrc.org. I mentioned that the tool went through 4 phases of field testing, and just wanted to give you a little bit of an idea of why this is such a long and rigorous process. The initial step was development of an item pool, and so the items are the individual questions on the Protective Factors Survey. They were reviewed by experts, tested for a number of different things along the way, and you can kind of see, we won't spend too much time on this, but to let you know that it was not just thrown together overnight. There was a lot of blood, sweat, and tears that went into development of this tool. Over 1,500 parents participated in the development, so this means over 1,500 parents over the 4 years of testing completed the survey, and that data contributed to the statistical analyses that led to the validation and reliability of the instrument. The primary services that families were receiving when they completed the survey were home visiting services and community-based parent education services. As you can see, it was administered across the country by a number of different state-level and community-based agencies. Validation, which is one of the tests that happened along the way, we'll talk a little more about in a minute, compare the results of the protective factors survey to other already valid and reliable instruments, and you can see the list of instruments that were part of that analysis. In terms of, we talk a lot about the protective factors survey being a valid and reliable tool, so we want to just touch a little bit on what exactly that means. Reliability is related to consistency, that the instrument over time measures the same way. So we get some feedback, and Mary will talk about this a little more later, I think, that some of the questions are hard for parents to understand, and that you're not sure that participants in your programs understand the meaning of certain questions. The tests for reliability say that over time and over this field testing, that the questions did indeed lead to consistency. So while they may not work for every parent, they work for the majority. It's not 100% perfect, but there is adequate reliability and consistency. Validity is accuracy. So that means when you ask questions related to parental resilience or family functioning, for example, that those questions actually relate to family functioning. It's an indication of the extent to which the assessment measures a particular construct, so that the questions really are linked to that concept that it's trying to measure. So why is this important? I've worked in social service delivery for a number of years and have myself been in positions where we needed to measure something and didn't really have time or money or resources to find a tool that that would work, and we would create a survey that addressed the questions that we had. So why do we kind of push this reliability and validity? Why is it important? Unlike the survey that I created on my own for use in my program, I don't know that it's reliable, that it's measuring the same thing over time. I don't know if the questions I ask really do relate to the concepts that I want to measure. And so when I try to use that data to look over time at how my program or how my families were doing, I didn't really have anything that I could back up with statistical analyses that showed the results actually were meaningful. I will say, and I think Mary will get to this a little bit later, but one piece that's unique about the Protective Factors Survey is that it's fairly short and concise, easy to complete, and it's also available free of charge. So despite the fact that there may be other tools out there that measure specific protective factors, many of them are at a cost, and many of them only, again, measure that one protective factor. The PFS was written at a 5th grade reading level, so again, we've heard some feedback from the field that sometimes questions are hard to answer. In particular, there are questions as part of the Protective Factors Survey that are negatively worded questions. And that those are sometimes hard to understand. I know for myself, reading through, I stumble on those, and quite honestly, that's the purpose of the negatively worded questions, to stop folks along the way, to make sure they're paying attention and not simply putting 77777 the whole way down. It lets you know the accuracy of the data that you're collecting. Sure, a little bit of background noise, so if I can just remind you, if you can mute your phones, that would be great. There are 3 parts of the form. Mary will talk a little bit more about those as we go through the administration, but there is a piece that, one-page piece that staff complete with some background information on the client. One page of client demographic information, and then 2 pages of the actual PFS instrument. And we do have programs that don't complete the first portion of the first 2 pages, the staff form and the demographic form, because they collect that in other ways, and there are some pros and cons to that. There is a Spanish version available that has also been tested for reliability and validity. When you translate a tool like this into other languages, the validity and reliability don't automatically translate with it. The new tool needs to go through the same type of testing. So just to caution you, if you have other languages that are used in your community that you'd like to make the tool available for, and you have it translated, you're doing so with sacrificing the validity and reliability of the tool. One of the drawbacks to the tool at this point is that we are not at a place where we have cut scores. And to be quite honest, I'm not sure that we'll ever get to the place where we have cut scores. And what I mean by that is that you know if your mean score for social connections, social supports is a 6, that you know your program is good or doing well. It's a high-quality program. The reason for that is the context of the communities and regions in which you operate. So a 6 in one community might be great, whereas a 5 in another community might be great. And because of those variances across locations, there will be some challenges to coming up with norms. What I'll remind you of is that the tool was really developed as a tool for continuous quality improvement of programs. It's really meant to be used longitudinally to see, or really over time, to see is your program making a difference, and to help you with your program decision making around services and supports related to the protective factors for families. I mentioned earlier the Center for the Study of Social Policy, or CSSP, and the protective factors work that they've done. Many people ask, and rightly so, how the CSSP work lines up with the protective factors survey. So put together this graphic so that you can kind of see how it lines up. The first 4 protective factors are measured, of the CSSP model, are measured directly by the protective factors survey. CSSP has an additional protective factor, the social and emotional competence of children, that is not included in the PFS. The obvious reason for that is that the PFS is a parent measure, and you can't collect information from parents to measure the social and emotional competence of children. To measure that, you would need to collect data on that child specifically. Through the literature review, however, the protective factors survey work identified an additional factor, nurturing and attachment, that was prominent in the literature and can be measured from a parent's perspective, so that was added to the tool. And as many of you, know in your work, nurturing and attachment has a lot to do with the development of social and emotional competence of children, so I think you'll probably see that in some of the questions. Most of you know the protective factors and use them in practice more than I do, and can probably give better examples, but we wanted to put some of the operational definitions of the protective factors in here for you so that we can be clear about the concepts that the protective factors are representing. I'm not going to read through these at this point, but just point out a few things. You'll notice that the first factor, the family functioning and resiliency, captures a couple of different constructs, including coping skills, communication, and problem solving. When the pilot testing and field testing was conducted, these concepts were very much related to each other. There was high correlation among them, and so they were put together into a protective factor of family functioning and resiliency. Next, it's really important to remember that each of these factors represents perceptions, so parent or caregiver perceptions of their functioning in each of the domains. We ask about perceptions because much of the research suggests that perceptions are linked to family well-being and quite frankly easier to measure. Lastly, the focus of the protective factors are really on factors that can be influenced by prevention efforts. So these are things that through your work we would expect to see change. There are certainly other protective factors out there. I think about things like poverty and income that we know are strongly correlated to abuse and neglect or prevention of maltreatment, but they're not things that our programs are expected to change. With that, I'm going to invite Mary to share with us about administration of the tool.
Thank you, Rebecca, for that background on the PFS. Rebecca covered a lot of information about how the PFS was developed and the validity and reliability and a little bit on the protective factors. Now I'm going to talk a little bit about how to administer the protective factors survey. And I see many of you on the call are, we have some CBCAP grantees, some service providers who provide parenting classes, and I also see some home visiting staff. So I think this is going to be really applicable to those of you who are out in the field actually working with the families and administering this to them. Okay, so part of the survey materials for the protective factors survey include an instruction manual, an informed consent statement, and then the actual 2-page survey, or 4-page if you choose to use the staff form and the demographic form. I am going to close out of this PowerPoint briefly to show you the instruction manual. And that is one of the, probably one of the highlights of using the PFS is that as service providers, you have an actual manual in case something happens and you have questions, or we'll go back up to the top here. So here's the manual. This is available at friendsnrc.org. It's going to cover a lot of things. You're going to get some background, the purpose of the PFS, a description of what the PFS is, and the protective factors themselves. There's also some instructions about preparing the survey, informed consent, specific guidelines for administering the survey. And one of the most important things in here is also the survey scripts. As Rebecca said, sometimes we do hear from some of the service providers that sometimes the families don't always understand what the questions, or sometimes they need to be reworded. So there are actually some forms down here that where we see different ways to paraphrase questions, and so this manual is actually very, very helpful for those of you who are out in the field administering this. And this is the protective factor survey. This is the staff form. We have agency IDs and participant IDs. One big piece of the staff form is also noting which types of services are being provided. And here is the demographic form. And sometimes it's good to look this over before administering it. That way we know exactly which questions we are going to be asking our families, and the more we get to know our families, the more we can frame these questions that we have to ask. Some of them can be uncomfortable for people, but here's the demographic form, and here is the actual protective factor survey, all 20 questions. So bear with me while I get back to my PowerPoint here. But I thought that might be helpful to just touch on that and show you the resources that are available through Friends NRC. So, You can take those into the field with you, review them before you go visit your families. So they have a lot of different uses. Preparing the survey is very important. Many of you have an informed consent form that you already use with your program or agency. And so we understand that, but if you do come across a family that you have not yet used an informed consent form with, or maybe your agency doesn't have one yet, there is one available in that PFS manual. An example. Part of preparing the survey, and probably the most important part of preparing the survey, is to put the ID number of the family on the survey. Many of you are going to refer to your program or agency supervisor to discuss how you assign ID numbers to your families. But because the PFS survey is not anonymous, we do track those. It's confidential. We don't share that information from the families with others. However, we do use ID numbers to track the families, so that way we can do a pre-test and then use the same ID number to track a post-test. As I said, informed consent is very important. Part of that includes reinforcing voluntary participation in this data collection. And as Rebecca said, sometimes these questions are sensitive, so sometimes we need to remind our families why we're asking these questions and that there are no right or wrong answers. Some families do want to follow up with their service provider afterwards if they do have questions about that. And we want to remind the families that the purpose of gathering information through the PFS is so that the family can report whether or not the class or the service is helpful. So based on the information the family gives, the agency can work harder to make programs something that are useful for families. And again, the benefit of keeping this data confidential is that we may get more accurate information from families, but also if we can't keep the data anonymous, but if we can keep it confidential, that's good. We can also use this, even though the PFS wasn't identified as an individual assessment or validated as an individual assessment, we can use the PFS as a conversation starter with families by reviewing that paper copy of the test that we administer. So for example, if a PFS is administered to a family and we see that, sorry, I'm having some PowerPoint troubles here. And we see that maybe we get an answer from a family where they may answer low on their social connections. So maybe they don't have a lot of neighbors or friends, relatives who they can contact if they have a crisis. Maybe we want to ask them a little bit more about that. And again, it can just be used as an individual assessment, or not as an assessment, but as a conversation piece. You know, I noticed that you answered a 2 on this particular question. Let's talk about that more. So again, it's not anonymous, but the benefit of that is that as service providers and those who are working directly with the families, we can use it as a conversation piece. So as far as administering the survey, there again I showed you the manual about introducing the survey, and there is a script. A lot of the administration, some of it, again, I noticed we do have some home visiting staff on the webinar, so some of it will be face-to-face and one-on-one in an interview. And some of those, some of you I know provide parenting classes, so you'll be in a larger group setting. In that case, this survey can be administered in a group, but the script stays the same, and so it's pretty easy to follow. There might be people who are participants who do not want to participate in the survey. There are a few arrangements that can be made. For example, if you'd like to administer the survey at the end of a class Maybe some participants who wish not to participate can leave early. If you choose to administer at the beginning, maybe there are pamphlets or something that you can provide to the families who wish not to participate while the rest of the families take the survey. There are any number of ways to do this, and many of you know your families better than I do, so you'll know, what alternative arrangements you'll need for them. And again, there are some sensitive questions within the protective factor survey, specifically in the demographics. We've heard from some of our CB-CAP grantees who do administer the PFS that, some parents are a little bit reluctant to answer. But, I think the one thing about being out there and, most people who are on this call right now are, they're people, and you're great with building relationships. So, I guess it varies by individual family, but addressing any questions openly and explaining why this data is being collected and how it's going to be used is very important. Letting the parent know that this information is confidential. It's not going to specifically be linked to them outside of the agency or program. And this is something that depends on the program or agency, and again, refer to your program or agency supervisor. But some programs have waited a certain amount of time to establish comfort and to kind of establish that relationship a little bit before administering the PFS, or leaving the demographics till the end because those seem to be the more sensitive questions. In addition, sometimes it's important to normalize some of the responses. So, for example, if a parent may not want to answer a question about, how much money they make, or, how they parent their children, or whether or not they're always happy being with their child, we may say, many parents struggle to meet financial needs, or many parents struggle to meet emotional needs, and kind of making that known that, everybody needs help sometimes, and you're not going to be judged based on the answers you give. But what's most important, again, is to use a consistent script for administration. So if you say one thing to one family and another family has the same question, it's just important to answer or to use the same information. As far as specific administration instructions, this is post-test administration details. It is the exact same survey given at pre-test. There are no differences to that. Right. So part of tracking participants is to provide an ID number to a family and to utilize that ID number on the post-test as well. Another thing that relates to tracking is using a target child. So participants are asked, who do you believe in your family will most benefit from the services you are receiving? It is important to try to use the same target child, because your answers, if let's say you use your 6-month-old versus your 13-year-old, your answers are going to look a lot different. We've heard that from a lot of the CB-CAP grantees that if we don't remember exactly who we use for the target child, the answer to "my child intentionally misbehaves to upset me" may look a little bit different depending on if it's a 6-month-old or a teenager. So I'm going to move a little onto data management or data collection and management. This is completely up to the agency or program. This is decided individually by your program supervisor, agency supervisor, but there are many options for data collection and data management. So here we are, we have the PFS, we have these printed copies, hard copies of the forms and of the actual PFS. So now, what do we do with these paper copies? We keep them secure, we destroy them in 3 to 5 years, but what else can we do with them? And another question we have a lot is, can participants complete the PFS online? But we don't have any systems currently set up to do that, but I'm sure it's not out of the question in the future. So there are many options for online databases. Let's say we don't just want to keep those PFS forms in a box for 3 to 5 years. If we want to put them in a database, Friends National Resource Center for CBCAP offers a database. The Center for the Study of Social Policy also has one. And in addition, in the past year, Kansas has developed a web-based statewide database. CBCAP grantees have participated on a CBCAP database now for a couple of years. However, there has just been one available for all preventative, well, actually, more than that, most services in Kansas. I'm going to go through and just show you a little bit what this looks like. And this website is for data management purposes. There is a small fee associated with this particular database. But once registered, programs have a home page which looks similar to this. As you can see, we have an area to enter new pre-PFS data. Once you enter a pre-PFS into the database, underneath the post-test, that tracking number, that ID number, is now listed underneath that, so that way you know, here are all the people who I have not yet entered a post-test for. This website or this database also generates reports. There are PFS pre-reports, so any pre-PFS that you enter can be generated into a report that looks similar to this. We do have some, for example, some CBCAP grantees who conduct a parenting class, a one-time parenting class, and they only do the PFS pre-report. And use it as a, somewhat of a needs assessment to kind of get an idea of where the participants are in family functioning, where they are in social support, just to make services as great as they can be for the participants. So here's a PFS pre-report, and this database also generates a summary report. We'll go through a little bit more about what this all means later, but this is what is provided to agencies who would use this particular database. So you can see the numbers and the columns and improvement, and we see all of the different subscales, but what does this all mean? After we've gathered all this information and we get all the numbers, how do we interpret that? How do we make that applicable to the services that we're providing? So if you choose to administer the page that requires demographics, which some programs do, some programs don't, and it is really up to the program supervisor. But these are those specific demographic areas that the PFS gathers. It's great because you can see who specifically is taking the PFS, who is participating in the PFS. Sometimes, we do hear that it does provide more work for the participant. Some participants feel it can be intrusive at times. And many of your programs already gather this data. So I guess the contrary, that could be true as well. Maybe parents are already used to having to put this information down and provide that to you at your program or agency. So it's really up to the program supervisor. So we gather demographic data. What does it mean? We really use that as programs or agencies. We've seen use that to address reach questions. So we want to know who we're serving and who's our target population. And if we know who our target population is and we can look at that data, are we reaching them or who are we missing? It also helps to identify implementation needs, so child care, bilingual services. So, for example, what we've heard from some CBCAP programs here in the state is that they've been administering the Spanish version of the PFS quite frequently. So if we know that, then maybe we know that some of our other pamphlets or brochures or classes or services that we provide, maybe those need to meet the need of non-English speaking families too. So it kind of gives us a little bit of an idea of who we're serving. We can also identify potential target areas like income and education. And in addition, like I was saying earlier, if you choose as a service provider to use that PFS, you know, with an individual family, for example, if you want to look at their specific PFS answers, sometimes it helps to frame that a little bit if we know who we're speaking to. If we know a little bit more about culture, a little bit more about income, you know, sometimes it might make us address certain questions differently. This is an example of demographic data that can be generated from an online report. This particular demographic data was covering, was from 21 different participants who participated in the PFS last year. So if we look at this, we can consider the fact that the purpose of the PFS is for program improvement, so we can start conversations about service delivery as it relates to these demographics. So, you know, we see that the average age is 25. You know, we're serving 90% females and 9% males. So, you know, maybe as a program or as service providers who are all at the table at one time, maybe we can talk about, you know, were we doing services for fathers? If so, you know, maybe we want to strive to increase how many males we're serving each year. Or if we move down a little bit to race and ethnicity, we can see that roughly 20% of our population served who took the PFS again were African American, and we have roughly 5% Hispanic or Latino and 70% European American. But maybe, you know, in our specific community, we know that we've recently had a higher population of Hispanic or Latino community members, and maybe as an agency or a program, we want to go ahead and see if we can increase that number a little bit more and reach out to those families more, knowing that they may be new to the community. So, I mean, as you can see, you can use this in a wide range. I mean, this provides you just a snapshot of who you're serving and maybe what their needs are. Another thing that sticks out to me is highest level of education. So we see that, you know, 42% of our participants had some high school. And if our average age is 25 and 50% of them have only had some high school, maybe we want to provide services to learn more about how to complete a GED. As you can see, it just gives you a snapshot of who you're serving and maybe some direction on where you want to go with your services. So that covers the demographic data. Let's move on a little bit to tips for reading the pretest data. So the pretest is going to look at your 4 subscales and then your 5 knowledge and development items. I'm going to flip to our example here. Okay, so here's our pretest. The pretest data can be used as somewhat of a needs assessment. We want to see where our families are. And we get the mean scores, provide the average responses. This count of 837 represents the number of respondents to our pretest. And the standard deviation kind of gives us an idea of the spread of our responses, maybe how big our range was. So you can see that this can be very helpful. In addition, if we do this at the beginning of services for a specific program, maybe a parenting class, for example, I noticed that item 15, our mean is 3.06, which the higher the mean, the better. So I praise my child when he or she behaves well. That's obviously not, we don't have cut scores, so we can't say good, bad, or the other. But if I know it's 3.6, maybe as a program or as a service provider, I wonder if we can't raise that. Maybe we want to provide, a few more, maybe a session on positive parenting, or, there's just a wide array of things you can use the PFS pre-data for. So again, the uses of the pretest data are to assess the needs of clients at the beginning of services and to provide a snapshot of the families. Moving on to post-test data. Now the post-test report is going to look a little bit different than the pretest because we have more information about our families and about directions that we may go as an agency or a program. So here's the PFS summary report. So we get 3 columns. We have the pre-test, the post-test, in the improved column, change scores it says. We want to focus again on the mean scores and kind of comparing those between the pretest and the post-test. The improvement column is interesting because it tells you the percentage of respondents who showed improvement, but it doesn't include those who stayed the same. So sometimes we caution a little bit against using only the improvement column. In addition, interpret results carefully, because if you have less than 10 respondents, the data may not reflect your actual service provision. So again, if there are less than 10 respondents, be careful. We can see with this particular report we have 234 pre-test and post-test. Another thing that's important to remember, you'll see here that the count varies down these columns. If a participant does not answer within these top 4, family functioning, social support, concrete support, nurturing, attachment, within those subscales, if a participant does not answer if a participant chooses to leave more than one item blank, their pretest is not counted for in the summary report. In addition, we'll see that some of the participants may have left, some of our knowledge of parenting items blank, which means that that's why the count's lower. They may not be accounted for in this particular report. But as we can see, mean scores from the beginning, from the pretest to the post-test, some of them go up. You'll notice under concrete supports it went down by a little bit. And sometimes we talk to, specifically I think of our peer review process with our CB-CAP grantees, we talk about why that might happen. And we noticed that, at the beginning, maybe families want to answer desirably. Maybe they want to say, I have all the needs, I have everything, all of my needs met, and I know where to go if I need help. But, through the process of, getting to know, not only getting to know their service provider, but also maybe learning a little bit more, they may answer more honestly, or actually just may be more aware of the needs that they have. So that could be a reason why the means go down, or why, again, why our means go down and why our scores look differently. Some of the uses of the post-test data include assessing progress towards targets and assessing change over time. So, for example, maybe as a program, you might want to say targets for improvement rates might be 50% of the clients show improvement during the program, or we want all of our means to be at a 6. There are not cut scores set for the PFS, but that does not mean that each agency or program can't look at the PFS and decide that maybe they want to set improvement rates, or they want to set targets and goals to reach for their specific services. More rigorous methods would be to use statistical tests to assess change from pretest to post-test. If you're not savvy in this area, there are several online statistical calculators and consultants that can help you, and we've listed one under statistical tests. After working with the PFS and working closely with the CB-CAP grantees, some of the frequently asked questions we have include, what happens when a participant decides to skip a question? So in each of the subscales, we do explain that. If more than one question is skipped in the subscales, that particular subscale, those responses will not count under that subscale. The fewer questions we have answered, the less accurate the data is, so we have chosen to eliminate those responses from the subscale if more than one question is skipped. In addition, we also have questions about the target child. Just make sure as an agency or program you're consistent. Encourage participants to pick the child who they think will benefit most from the program services, and then consider that same child for the post-test, because again, answers will look different if the target child is 6 weeks old versus 16 years old. In addition, we are also asked, how much, as a staff member, how much can I assist the family in completing this. We do encourage service providers to follow the script, and there's also paraphrasing ideas in the manual, which we went through earlier. So at this time, does anyone have any questions that they would like to ask?
Thanks for that. This is Rebecca, and I just wanted to jump in with a couple of additional points. We've talked a lot, Mary talked a lot about the subscales, and wanted to refer you to page 24 of the user manual. That will tell you which of the questions on the PFS relate to which subscale. The other piece about the scoring that I would caution you on, there are negatively worded questions, and page 24 of the user manual also describes this. They're called reverse score items. So for example, on those 5 or 6 items, a 2 is good, whereas on the rest of the normally worded items, a 6 is good. So you need to reverse score those items, and there are instructions to do that. If you are not going to use an existing database, just make that caution and point that out to you. The other logistical thing related to the webinar today that I neglected to mention at the beginning was that the webinar is being recorded, and it will be posted on the KECCS website. A link will go out to all of you so that if you want to access it or have other staff partners in your program listen to it, you'll have access to that. Are there any questions?
We'd like to ask a question.
Sure, go ahead.
Oh, I'm sorry. A suggestion. When we enter the data online for the test, the pre-test and post-test, I think it might be helpful if we had some other reporting options, like maybe where we could identify or say, okay, we want to run a report that shows pre- and post-test data for a certain date range or one of our workers. Because when we identify, our mentors identify their participants, but they use like the first 2 letters like initials. So we can tell by the test who administered it. And we like to have sometimes reports like say, okay, these are Joan's participants, and this is the data from her participants.
Thanks for that. I guess 2 responses. The first, the date sort is actually being worked on right now. We requested that of the tech support, and that should be available within a week or so. It's been added to a test site, and we're testing it to make sure the date sort works. One thing I'll caution you on with that, when you date sort, the reports that are generated will, particularly the summary report that Mary shared, will give you matching pre-post data, so that you'll only get results for participants who completed both the pre and the post within that specified time period. So, for example, some of the programs that we're working with operate on the calendar year, but maybe they had somebody complete the pre, in November or December, and they're doing the post in February or March. When they do that calendar year sort, that participant won't show up on the report. So just as a caution there. In terms of the individual staff person, that's a great idea, and we actually have the ability to do that on the back end. So if you're interested in that, get in touch with Mary, and if you're using the Kansas database, we can get you we can sort that for you. On the front end, it's a little bit more complicated on the tech side, so it's sort of on our list, but it's probably going to be a longer-term thing. I will add to that and suggest that we have several programs or several agencies that have multiple programs within the agency, and they want to be able to compare program to program, and so you may want to sort that way also. Those are all things that we can do on the back end today, and that are sort of on the long-range plan for the front end of the system. And then for folks using other databases, that would be a different answer.
Thank you.
Sure. Other questions or comments? No. Well, hearing none, we just want to refer you to a few websites, contacts for more information about the PFS. You're certainly you'll find a lot of information on the Friends National Resource Center website, so I encourage you to go there. The Protective Factors Survey user manual is currently being updated. No major changes, but a few tweaks, and that updated manual will be available on the Friends website. You can get the English and Spanish versions of the tool there. The Friends database is available there. The Friends PFS database is an access database that you download to your desktop. So just as a caution to you, when you enter data into that database, it just resides with you. It's not fed into any type of larger system, and no one else has access to that data. And then here at KU, Karen Chang-Rios was one of the researchers involved in development of the Protective Factors Survey. We work very closely with her and have a great deal. Often we have conversations about the PFS, and she's definitely a resource to you, and feel free to contact Mary or myself as well. I'll give you one more chance for questions today. Okay. Well, thank you all for joining us. We hope this has been helpful to you, and we look forward to working with you more on the Protective Factors Survey and the great work you're doing in Kansas. Thank you.